The Black Men's Health Conference is back on again this weekend in Dartmouth. The aim is to get people talking about health social issues ranging from mental health to healthy relationships to racism. Russel Brooks is community activist and advocate for social justice around mental health and wellness in the Black community. Welcome to our studio.
Thank you for having me.
Tell me about what your message will be at this conference.
So there's a few key messages that I'm hoping to share at this event. So one is really just to kind of share some of my own personal journey. I think it's important to try to connect with the audience in as many ways as I can. And I think just being vulnerable around these types of things is a way to kind of make that connection, which I think is important in terms of trying to help people get the courage to kind of explore their own journey and pursue their own journey. So a part of my message will be sharing some of my own journey and kind of what's helped me along the way. I think it's truly important to help everyone who's attending the event understand, the urgency around, well-being and mental health for Black men, for Black communities, for the Black families. I think it's so critical for us to really prioritize that. So that will be a piece of my message as well. And then the other piece that I think is super important is just the need to engage young people around these issues as early as we can. We want to try to leave the younger generation in a better place than we all are. So to be able to kind of expose them to some of this stuff at an earlier age so that they can easier navigate, some of these societal issues, I think is so important.
Can you sum up what the lesson is you learned from your own personal journey?
That's a loaded question to try to sum up, but one thing that I will say is that you can find inspiration in places that you might not see right in front of your face. So for me, I had a relationship with a mentor, and I didn't know the significance of that relationship until recently. So those types of things are so crucial in terms of kind of navigating societal issues and mental health and well-being being at the forefront of those.
You talked about getting people, young people in particular, to ask or to access services. When they ask, what is the reaction? What's the reality that they face?
I mean, a lot of times when you try to engage young people in these, around these issues, they're reluctant to truly be honest and engage in a conversation because it's uncomfortable for them. So we need to find the ways that we can create that sense of comfort and a sense of safety so that they can have these conversations. So a lot of times, they'll try to laugh and try to just disengage when we try to invite them to have these conversations. So we need to figure out ways that we can make it more comfortable for them and then normalize it so that it's happening consistently.
What's missing, do you think?
For young people or just in general?
What would make it better? Well, generally, for Black men and mental health in particular.
That's a loaded question. I could go so many ways with that. I think one of the big things is representation. For Black men to be able to go to a healthcare professional and see someone that looks like them, see someone who understands, their lived experience and lived reality, I think is something that a lot of people don't truly understand when you're navigating, these types of problems or these types of issues and you're seeking support. To be able to see somebody that truly can see and hear you, it goes a long way, and it creates that sense of safety and security, and it's more inviting. So I think that that's a big thing that we need to try to address, and just increasing, the supports that are available. There is, gaps, there's barriers around a lot of these supports and services. So I think trying to find ways to make sure that we're providing, the supports and services that are truly needed, and that the cultural competency is being, included in those as well.
Just before we go, I know this conference has been around for a few years. But what kind of sessions will you be having?
There's a variety of sessions. So there's sessions around, spirituality. There's sessions around wellness and mental health. There's sessions around sexual health. There's sessions around masculinity. There's sessions around, the importance or the connection between, being mentally well and how that impacts, things like finances. There's sessions around, entrepreneurial, opportunities. There's just a range of things. We've taken feedback from, people who have attended in the past, and we've tried to make sure that we're listening to what they're looking for, and we're filling in those gaps.
I know you're expecting hundreds to attend. I hope it goes well. Thank you.
I thank you as well.